common question that we get at the surrogacy center from our potential carriers revolves around the medications that are required. So in order to do a frozen embryo transfer, there are medications needed before the transfer and then for several weeks after the transfer if it's successful. So I have my progesterone supplies here. This is not a medical tutorial at all. This is just for entertainment. It's not really entertaining, but just as an FYI, again, I'm not a medical provider. This is not me teaching you how to do this. This is just me showing you how my clinic has taught me to do this. So progesterone injections are, how do I put this? The biggest needle that's involved with any of these potential injectable medications. Different clinics have different protocols, but we've realized that pretty much no matter where you go, you're going to have to do progesterone. Progesterone is a critical hormone to support the embryo transfer and then to support the embryo growing. You'll need to do it for several weeks after a positive pregnancy test. My clinic has me tapering off at around 11 or 12 weeks. So again, all clinics are different. This is just my reproductive endocrinology practices guidelines. So one thing, wash your hands first. My clinic prescribes this certain size syringe, needle and syringe, but they also prescribe smaller needles to swap out, which is nice because I'm going to show you how big these can get. I also have a ton of these alcohol prep pads, and then I have the vial of progesterone itself. Now, this medication, the progesterone, is an oil, so you don't want to refrigerate this because oil, when it's cold, is going to turn solid. So just keep this at room temperature. It's pretty easy. Now, you can self-administer this, or if you have a friend or support person who can do this for you, that's great. I'm not going to actually inject myself because it's basically like on your butt cheek and nobody needs to see that business. But all right, so here we go. Whoops. They can, if you twist them on too hard, they can pop off. But that's pretty good size right there. But this is not the needle I'm going to use. I'm going to recap it, discard it, and swap it out with that slightly smaller needle. Now, it's a little bit smaller, not significantly smaller, but I'll take it. Now, again, I'm not actually going to inject myself, so I'm just going to recap this for a second. If I were to actually be injecting myself, once you recap or once you take the cap off, like you're kind of committed. So if you're actually going to do it, don't recap it. I'm a major germaphobe, so I just want to make sure that like we're not cross-contaminating anything here. So got that, set that aside. Take your alcohol prep pad. It's a little square. Take your vial, clean off the top of that. It's not sterile, right? So you got to clean that off. Otherwise, when you push the needle into it, if there's germs, bacteria on the top, it can then get inside of you. So then without putting this down, you're going to wipe the area that you're going to inject. Now I said it's on your butt cheek. It's kind of like up higher though. So like between your actual butt cheek and your back, I guess. And you've got two, so alternate between them. You'll be able to tell kind of where you last injected yourself too. So kind of move around. If you find a spot that's like kind of tender or bruised, find a different spot. I mean, there's enough surface area that you'll be fine. So wipe that down, allow it to dry. Otherwise you kind of get that extra pinching sensation with the needle. So just kind of like, whew, let it dry for a few seconds. So we're going to actually withdraw this. So pretend I'm uncapping it for the first time. My clinic has me on 1 ml. So I'm going to withdraw the plunger back to 1 ml. Push down the plunger. So we just put air in the bottle. It's vacuum sealed, so it's very important. Flip it down. And then it's okay if there's like a little air gap, that's fine. And it's an oil, so it's kind of thick. It's not like this fills up immediately. Sometimes you have to go down past your 1 ml just to get that all out. See, it's slowly filling. And pull it down as far as you need to. So once I have about my ml, there we go. You're just gonna push up the plunger to get rid of that air. There we go. So I'm at 1 ml. Pull it out. Doesn't really leak or anything like that. So now we're ready to go. Now this isn't going into a vein, so you don't need to worry or panic if you see like, oh my gosh, there's a tiny little air bubble in there. It's just going in your muscle, so it would be totally fine. No need to worry about that. But we've got the syringe loaded. All you have to do then is self-administer. Again, it's not like you have to jab yourself, but find your target spot. Again, your clinic will teach you how to do this yourself. I've seen clinics even like draw Sharpie circles, like here's where your target area is. So when you go home, you'll have no problem like being able to self-identify where that is. And you'll just press it in until it breaks the skin. And then once it's in most of the way, push the plunger down. Have a little tissue handy just in case there's some bleeding. Everyone's different, but for my self-injections, I bleed maybe half the time. It's a few drops. It's nothing super scary or significant. It's more like, oh, dang it. But that's okay. It's normal part of this. But anyways, so yes, progesterone injections. Are they super fun? No. Are they super important? Yes. So therefore, they're 1000% worth it. So anyways, as usual, like if you ever have any questions or concerns about any of this stuff, your reproductive endocrinology team will be more than happy to help. And if you have trouble connecting, that's where we as an agency can also step in. So there you go.